Ladies and gentlemen, today I want to share with you an often overlooked but profoundly impactful health phenomenon that affects many young women and girls, especially during the hottest months of the year, and yet remains largely misunderstood. Heat-induced hypotension resulting from poor vascular tone and autonomic neuropathy. Imagine a scenario in which a healthy teenager or a young adult steps out into the blazing sun for just a few minutes. She feels the heat intensify around her, and before she fully registers what is happening, she experiences a sudden sense of lightheadedness, overwhelming fatigue, profuse sweating, and shortness of breath. She might lean against a wall or sit down to steady herself, worried that she might faint. And sure enough, when a friend or family member checks her blood pressure, the reading is surprisingly normal, perhaps 100/70 or 110/70, and her pulse, although elevated, remains within a range of 90 to 105 beats per minute. This apparent contradiction between her subjective symptoms and the objective measurements can lead hasty, dismissive diagnoses. You're just stressed, you're overreacting, or it's psychogenic, implying that emotional factors such as exam anxiety or relationship troubles are to blame. However, the reality is far more tangible, and science tells us that some women simply have blood vessels that lack sufficient tone. In these individuals, even a brief exposure to intense heat triggers marked vasodilation, a widening of the blood vessels that leads to reduced blood flow to vital organs, particularly the brain. To prevent collapse, the body instinctively diverts oxygen and blood toward the brain, constricts larger arteries, and maintains blood pressure at seemingly acceptable levels, all while the peripheral tissues remain underperfused. The unmistakable sign of this imbalance is a pale, slightly yellowish complexion alongside symptoms that mirror those of mild hypovolemia or early blood loss, a low normal systolic pressure, a mild tachycardia, dyspnea, and pallor. This constellation of signs and symptoms can be easily misinterpreted as a simple bout of heat exhaustion, a label that often minimizes the underlying physiological derangements and the potential seriousness of the condition. To truly comprehend this phenomenon, we must delve into the intricate workings of our circulatory system and the role of the autonomic nervous system. Picture our blood vessels as a network of highways and byways, with the autonomic nervous system acting as the vigilant traffic controller, ensuring smooth, efficient flow. However, in some individuals, particularly young women, this traffic controller malfunctions, leading to an overdilation of blood vessels akin to traffic lights malfunctioning and remaining stuck on green. This constant, uncontrolled expansion of the blood vessels results in a reduced blood flow to vital organs such as the brain, kidneys, and heart. Yet the body's compensatory mechanisms, particularly the renin-angiotensin-aldosterone system, work tirelessly to maintain blood pressure within a seemingly normal range. Despite this, the brain continues to receive oxygen-rich blood, triggering the fight or flight response, leading to symptoms like lightheadedness, fatigue, sweating, and shortness of breath. This intricate interplay of bodily responses to heat is not merely a matter of individual sensitivity. It reflects a physiological imbalance with potential implications for daily life, physical performance, and overall well-being. Understanding this mechanism is crucial for accurate diagnosis and effective management. So, how do we unravel this medical mystery? The key lies in careful observation, detailed questioning, and a thorough understanding of the patient's environment. By delving into the circumstances surrounding these episodes, we often find a common thread: exposure to intense heat, particularly in the summer months. A closer look at the patient's lifestyle may reveal a history of similar episodes, perhaps dismissed as heat exhaustion in the past. Moreover, a comprehensive medical evaluation should encompass not only vital signs, but also a review of medications, allergies, and previous illnesses. Laboratory tests are typically not indicated unless other conditions are suspected. Armed with this knowledge, we can guide our patients toward meaningful lifestyle adjustments, helping them recognize the importance of staying hydrated, seeking shade during peak heat hours, and making informed choices about physical activity in hot weather. In essence, addressing heat-induced hypotension is about empowering patients to take control of their health. By shedding light on this often overlooked condition, we can help those affected navigate their environment more confidently, ensuring they enjoy the summer sun without fear of an impending faint. Thank you very much.